Regulation of secretion of gastric juice. Gastric secretion is accurately synchronized with the need for gastric juice. The mechanisms regulating the gastric secretion include neural control and chemical control. Neural control. Neural control over the gastric gland is exerted by the local enteric plexuses involving cholinergic neurons and impulses coming from central nervous system via vagal innervation. So that forms the extrinsic nervous system. Vagal stimulation increases the secretion of HCl by parietal cells and pepsin by chief cells. The vagal stimulation increases the H plus ion secretion by direct and indirect path. In the direct path, the vagus nerve fibers innervating the parietal cells stimulates H plus secretion by releasing acetylcholine, which acts on these cells through the M3 muscarinic receptors. That the molecular mechanism to increase the intracellular calcium on parietal cells, and it causes the direct stimulation of the gastric juice. In addition, acetylcholine also potentiates the effect of histamine on H2 receptors on the parietal cells. In the indirect pathway, the vagus innervates G cells and stimulates the release of gastrin into circulation through gastrin releasing peptide. The gastrin in turn stimulates the H plus secretion. The acetylcholine released on the vagal stimulation also acts on enterochromaffin cells, so which release the histamine. Histamine increases the H plus secretion by acting on H2 receptor on parietal cells, but the relative importance of acetylcholine stimulating their secretion is unsettled. Peptic cells are stimulated by acetylcholine released from vagus nerve or from the gastric enteric nervous plexuses. Chemical control. So different chemicals play important role of gastrin as it is a GI hormone produced by G cells located in the pyloric glands, the most known powerful stimulant of HCl secretion. Presence of the products of the protein digestion in the stomach acts on G cells to release gastrin. It stimulates secretory activity of the parietal cell and chief cells. The actions of gastrin are: gastrin stimulates the secretion of histamine from enterochromaffin cells. Histamine stimulates the hydrochloric acid secretion, and this is the principal way by which gastrin stimulates acid secretion. Gastrin also stimulates hydrochloric secretion by acting on the gastrin receptor in the parietal cell. This increases the intracellular calcium. To a lesser extent, it stimulates the chief cells to secrete pepsin. Coming to the role of histamine. Histamine released from enterochromaffin cells. Enterochromaffin-like cells bear both gastrin receptor and acetylcholine receptors. They release histamine in response to both circulating gastrin as well as acetylcholine released by the vagus fibers. The histamine release stimulates hydrochloric acid secretion from parietal cells by acting on H2 receptors. Histamine bind to H2 receptors via G proteins, that is stimulatory, and this increases the adenyl cyclase activity and intracellular cyclic AMP. Increase in the intracellular cyclic AMP and calcium act via protein kinases to increase the transport of H plus ions into the gastric lumen by hydrogen potassium ATPase. Then role of somatostatin. Somatostatin is secreted by D cells in the gastric glands, and they inhibit gastric acid secretion. Whereas prostaglandin E2 acts via G proteins, that is they mainly inhibitory and decrease the adenyl cyclase activity and intracellular cyclic AMP, and this is going to inhibit the acid secretion. The low pH in the stomach inhibits the secretion of H plus ions by parietal cells by negative feedback mechanism. The intestinal influences like fats, carbohydrates, and acid in the duodenum inhibit gastric acid and pepsin secretion via neural and hormonal mechanisms. The rate of secretion of pepsinogen is strongly influenced by the amount of acid in the stomach. Acids elicits additional enteric nervous signals to the peptic cells. Emotional responses. Psychic states have effect on gastric secretion and motility that are principally mediated via the vagi. Anger and motility are associated with hypersecretion of the gastric mucosa, whereas fear and depression decrease gastric secretion and blood flow and inhibits gastric motility. So this is the molecular mechanism, how different chemicals they are going to act on. Acetylcholine, it is going to act on M3 receptors. Gastrin, it is going to act on the gastrin receptors, where they are going to increase the intracellular calcium. And whereas histamine and prostaglandins, they are going to act on the G receptors, whereas histamine is going to stimulate the production of HCl, whereas prostaglandins, they are going to inhibit the acid secretion by altering the levels of cyclic AMP. Increase cyclic AMP, increase the activity of the protein kinase with the calcium, so that is going to increase the hydrogen potassium activity to increase the production of HCl. Phases of gastric secretion and their regulation. The phases of gastric secretion can be cephalic phase, gastric phase, and intestinal phase. Cephalic phase. Cephalic phase of gastric secretion occurs before the entry of food in the stomach. The secretion is initiated by sight, smell, and thought of the taste of the food. The cephalic phase is under neural control and it is mediated through the vagus. The 20% of the total secretion occurs in this phase. Gastric phase. Gastric phase of gastric secretion occurs when food enters the stomach. 70% of the total acid secretion occurs in this phase, and it is mediated by neural and hormonal mechanism. The neural mechanism is mediated by the distension of the stomach by food, which is going to stimulate gastric juice secretion. Which can occur through the local myenteric and vagovagal reflexes. Then chemical or hormonal control, where products of partial digestion stimulate the secretion of gastrin. Gastrin enters the circulation and stimulates the gastric glands. Intestinal phase. Intestinal phase of gastric secretion begins as the chyme begins to empty from the stomach into duodenum. This accounts for 10% of the gastric juice secreted. Initially, it occurs when the early phase of the intestinal phase. The secretion is increased and later it is inhibited. So this inhibition results from the following influences. It occurs mainly because of the enterogastric reflex and hormonal mechanism. Enterogastric reflex is a reflex mechanism mediated through myenteric nervous system as well as through extrinsic sympathetic system and vagus nerve. It is initiated by distension of small intestine in the presence of acids or protein breakdown products in the upper intestine and irritation of the mucosa, where by the reflex mechanism they will be inhibiting the production of HCl from the stomach. Hormonal mechanism, presence of acid, fat, protein breakdown products and hypoosmotic or hyperosmotic fluids and any irritating factors in the upper small intestine causes the release of hormones like CCK, GIP, VIP and somatostatin, which inhibits gastric juice secretion. So these are the different phases of gastric juice secretion: cephalic phase, gastric phase and intestinal phase. The cephalic phase is mainly the nervous regulation, where the sight, smell, thought and hearing of the food by the conditioned reflex, they can increase the HCl or gastric juice production. And when the food enters into the mouth, it can lead to the unconditioned reflex and it can increase the HCl production. Where gastric phase is when food enters inside the stomach, that increases the vagal secretion that leads to uh, the increased gastric juice secretion. Whereas the intestinal phase, and it can act uh, both by the neural mechanism as well as hormonal mechanism. Intestinal phase is mostly the hormonal when the chyme enters into the upper part of the intestine. So there will be release of various gastrointestinal hormones like secretin, CCKPZ, somatostatin, GIP, and VIP. So they are going to lead to the inhibition of gastric juice into the later part, and this is called as the enterogastric reflex. Whereas in the initial part, the 10% of the gastric juice is caused by the production of the